Well, let's get started. So today we're going to be talking all about how you can use bootcamp.com to pass the NCLEX. So I'm going to be taking you over to our live site and giving you kind of the grand tour of everything that we have to offer so that you can pass your NCLEX with flying colors. So all right, so before we talk about what Bootcamp is, I want to tell you a little bit about who we are. So we are a pretty small team of nurse educators. We're small but mighty. So we have nurses from all over clinical practice areas. We have OB, we have psychiatry, we have critical care. And so if we combine all of our expertise together, I can promise you we have many years of experience to bring to you. And we've developed this NCLEX product that looks and feels like the actual NCLEX. And I think all of us here will tell you that we wish we had something like this when we took the NCLEX because it looks and it feels like the real thing. All right, so let's jump in and take a look. Okay, so the biggest question that I get from nurses who are studying to take their NCLEX is they say, oh my gosh, they're like, where do I even start? There is so much content. You just finished nursing school. You're overwhelmed. You just want to take a little mental break, right? And now you have to study for the NCLEX, this big exam that's super stressful, right? So we heard you, we have you covered. So the first place I always tell people to go is to go check out our study schedules. So let me show you what those look like. We've taken the guesswork out of studying for you. Okay, so this is our live site. This is what our NCLEX Bootcamp site looks like. And if we scroll over to the left-hand side, you can see my mouse over here. We can scroll down to this spot right here that says Study Guides. And we'll click on that. And we have 1 month, 2 month, and 3 month study schedules. So for all of you who said you were taking the NCLEX very soon, maybe you're going to be taking it in September, you will probably find a nice fit with our 1 month study schedule. So I think I actually have it open right here. Okay, so we'll click on that and take a look. And this breaks down everything day by day for you. It's taken all the guesswork out of studying. You just follow the schedule, and by the time you get to the end, you'll have studied everything you need to be successful on the NCLEX. So let's take a look at what we have in here. So we always say to start off by taking a look at our study guide, and then start with our next generation NCLEX course. And so that is a course made by Dr. Emily, who is moderating today. And she has done an absolutely fantastic job of giving you a great course that talks all about what to expect with the next generation NCLEX, because it is still fairly new and there's a lot of anxiety around what does this look like and what should I expect, right? So she breaks it down for you and shows you everything you need to know about taking this new exam. And then from there, you can see that we have which case studies you should be doing, and I'll show you what those look like. We have when you should be taking your readiness exams, which we'll look at as well. And then it talks about which standalone questions you should be doing. So for example, by your 3rd day in, you're going to be doing cases 3 through 6 and answering about 80 standalone questions. And so this breaks it down into manageable chunks so that you don't end up feeling super overwhelmed as you're preparing to take that NCLEX. So let's take a look at what some of our questions look like so you'll get an idea for what it's going to feel like as you're going through this schedule. Okay, so you saw on that study schedule that they talked about doing standalone questions. So we said, do 40 adult health questions and 20 maternal and OB or something like that. And so those questions are going to come from our comprehensive test bank. And so if we go back to our site, you can see what this looks like. So there's a couple different ways to get to our question bank. The first is that you can come right down here where it says standalone questions. And if you click on that, you can pick from the topic that you want to work on. So you can do fundamentals, critical care, child health, and then you can create a test from there. Or you can go over here to this big purple button up here. And this one's my favorite because you can really customize what you want to see in here. So if you click on that, you can come in and you can pick from tutor mode or timed timed mode, and then you can pick from the question pool. So you can do unused questions, which means these are questions that you've never seen before. You can pick from your tagged questions, and I'll show you what that means in just a second. You can pick from your bookmark questions, or you can just pick from a pool of all the questions, and that might include some questions that you've already seen before. And then from there, you can break it down by subject. So say you're like, I want to do pharmacology, and you can even break that out further by picking which group of meds you want to be tested on. And then from there, you can pick how many questions you want on that exam. So you can really get pretty detailed into the exam that you create and really focus it specifically on the areas that you need to work on. So let's take a look at what this looks like. So I'm going to go to my bookmark questions because I've handpicked a few of them for you. And since we're here, I figured we might as well get some NCLEX practice in. So we can do a question together, and then I'll show you what this looks like. So let's do this one. So this is a pharmacology question. So you'll notice that our standalone questions look a lot like what you're going to see on the NCLEX, which is great because there'll be no surprises on test day. So let's answer this question together, and I'm going to keep an eye on the comments. So if you guys know the answer, shout it out for me so we can see how you're doing. Okay, so in this question, we have a nurse who's caring for a client diagnosed with major depressive disorder. So this is a psychiatric client, and their dose of fluoxetine was just increased yesterday. Okay, and then we're being asked which assessment finding is most concerning. So before I take a look at my answer options, I like to take a second and think about what I'm actually being asked here, because as we know, it's really, really important to read our question in STEM carefully, right? So we don't end up making careless mistakes. So we're being asked which finding is most concerning. So that means that any of these findings could be concerning, right? But we're looking for which one is most concerning. And so typically most concerning is going to be things that have the potential to be life-threatening or pose a safety risk, right? Those are our most concerning things if we're looking at it from a prioritization standpoint. So we're looking for the most concerning findings. So let's think, what do we already know about fluoxetine? Does anybody know what kind of medication this is? Oh, a couple of you are already on it. You're way ahead. So fluoxetine is a selective serotonin reuptake inhibitor, right? Which is kind of a mouthful. And so this is an SSRI. It's an antidepressant medication. We use it for the treatment of depression. We also use it for anxiety disorders. And so what do we know about fluoxetine? What are some common side effects? Yeah, you guys are on it. So SSRIs, common side effects are going to be what? GI upset, right? It's pretty common. We know they can cause sexual side effects, which are pretty common. And how about really serious adverse reactions? What do we know about SSRIs that can happen? A lot of you are already shouting it out. Serotonin syndrome. Yes, you got it. So serotonin syndrome is a potentially fatal reaction to SSRIs. And so when I think of serotonin syndrome, I always think sweating, shaking, and strange behavior, right? So they're going to be sweating, they're going to be diaphoretic, they're going to be shaking, which means they're going to have tremors and muscle rigidity, and they're going to be exhibiting strange behavior, right? So mental status changes, they might be confused or agitated. So knowing all that, I think it's probably going to be pretty easy to answer this question, right? So our first option is nausea. Well, we already said that GI side effects are pretty common, so that's not necessarily concerning. GI side effects usually go away on their own with SSRIs. So I'm thinking probably not our most concerning, right? And then we have number 2 is a headache. Well, that's pretty vague, right? I think you'll have a hard time finding a medication that doesn't have headache listed as a possible side effect. So without more information and just a headache, probably not the most concerning, right? And then we have continued reports of low mood. Well, we know that SSRIs can take several weeks to start working, right? So if this dose was just increased yesterday, would we expect that client to feel better already? Probably not, right? It's going to take a little while. So then we have our last option, which you guys are all shouting out, is beads of sweat on the forehead. Because remember, we said serotonin syndrome, the big concern with SSRIs is going to be sweating, shaking, and strange behavior. So they have beads of sweat on their forehead. That's a pretty good indication they may be experiencing symptoms of serotonin syndrome. So I am concerned about that, and I definitely want to follow up. So I'm going to select that, and then I'm going to hit submit, and then we're going to see what we get when we hit submit. And this is really where the magic happens, and really where you're able to pack in a lot of learning in a short amount of time. So we're going to get a couple things that pop up here. The first is going to be this box at the bottom, and it's going to tell us if we got the question correct or incorrect. And so because this is a standalone single best item, it's going to say 1 out of 1 points. Now this might look different if we had a select all that apply. It might tell us we got 2 out of 5 or something like that, depending on how many correct answers there were. And then if we go a little further to the right, it's going to tell us the percent of people that answered this question correctly. So 53.4% of users in our bank answered this question correctly. So if you got it right, you're doing better than you're in the top 50%, we'll say. And then if we go a little further to the right, it's going to give us a scoring rule. And so single best items are a 0-1 scoring rule, meaning you get 1 point if it's correct, no points if it's wrong. Now, if this was a select all that apply question, we might see a plus-minus scoring rule. So we get 1 point for correct answers, no points for incorrect answers. And then over here, we have our time spent on the question. And this is really important because we know that on the NCLEX, you can have a max of 150 questions, and you have 5 hours to take the exam. So if we do the math, we have about 2 minutes per question, right? So we want to make sure that we're on pace with that. So if you do end up getting 150 questions, you'll make sure that you can finish that exam on time. All right, and then if we scoot a little bit further to the right and we look just above my head here, we'll see the explanation for this question. And so we've written these explanations to be really concise and include only the information that you really need to know. So all of our explanations are under 250 words, which means they're easy to get through. And we know that not everybody learns the same way, so we've included some different things in our explanations to help with your learning. So we've included a lot of imagery. So here we have kind of a depiction of what serotonin syndrome it might look like, right? We have the muscle rigidity, we have the sweating, we have the restlessness, the shivering, the shaking, right? And so it's going to give you an idea of what those symptoms are going to look like. And then if we keep scrolling down, you'll see that we also have some images embedded throughout to kind of help you get a sense for what's going on. And then we'll have the correct answer explanation. So why was the correct answer correct? Okay. So it's going to talk a little bit about that. And then if we keep going down, it's also going to tell us why the incorrect answers are incorrect, which is really helpful because our questions are specifically designed to not only include learning about the correct answer, but there's also learning points included in the incorrect answers. And that's why we can pack so much learning into one question. So it's always really important to read those. And then we have our key takeaway. And this is kind of saying if you learned nothing else in this question, this is what you should take away from it. Because we can kind of predict the types of questions you're going to see or the types of content you're going to see on the NCLEX, but we can't predict the specific question that you're going to get, right? We don't know that. But we do know that if you get a question on serotonin syndrome and you understand that this can occur with SSRIs and that these are the main symptoms you should be looking for, you're going to have a real high likelihood of getting that question right on the NCLEX because you understand kind of the key concepts around this topic. Okay, and if we keep scrolling even further down, we have our Ask Bootcamp AI where you can put in questions if you want a little bit more information on something. And then if you still have questions, you can kind of see it right here behind my head. You can hit this button that says Contact Our Team. And so this will tag the question and you can send in your comments or questions about the specific question and an actual nurse will get back to you within a couple of hours. So if you have feedback or questions, don't hesitate to use that feature as well. Okay. So that is our questions in our bank. So we also have, you'll notice on your study guide that we also have a lot of case studies for you to practice with because we know that the next generation NCLEX has case studies and these are new. So fortunately we have a lot of them for you to practice with. Oops. So I want to show you what these look like because we've gotten a lot of positive feedback on these from students saying they really like our case studies. So in our case studies, you will find that these have item types like you're going to see on the actual NCLEX. So in this case study, this is a highlight type question in the first question. And then if we click through that, you're going to see that each case study, just like on the NCLEX, has 6 items. So you'll be able to click through and see all the items and see all of your patient data tabs pop up as you move through the question. So if we go ahead and select some answers, I'm just going to randomly click on some here. And if we hit submit, we're going to see something similar to what we saw with our standalone questions, but we have a few additions in our case studies. So you're going to get the same banner, and unfortunately with my random clicking, I did not get any of those answers correct. So you can see it's going to tell us that here. And then what students really like is that we have video walkthroughs for all of our case study questions. So every question in every case study has a video walkthrough by one of our nurses telling you why the correct answer is correct and why the incorrect answer is incorrect. And it's going to talk through how to think about this question like a nurse and how to think about these case studies in a way that's really going to help you be successful on the NCLEX. So in this case, we have is that they're all less than 5 minutes. So you don't have to sit and sift through a ton of content. They're short and to the point and tell you exactly what you need to know. All right. So the other thing I want to show you is our readiness exams. So our readiness exams, we have 4 of them, and they are specifically designed to predict how likely you are to pass the NCLEX, so that you can take these exams in the course of your study, and depending on your results, you can go into that NCLEX feeling really confident in your ability to pass that exam. And so the nice thing about our readiness exams is that these are not just a random compiling of NCLEX standalone questions and case studies. These exams were specifically written to match the NCSBN test plan. And by that, I mean that each of these exams are 100 questions. And so on that exam, you will see 14% of those questions will be physiological adaptation, 12% reduction of risk, 18% management of care, and so on. And so the questions that you get on our readiness exams are very closely going to mimic the types of content you'll see on the actual NCLEX. So let me show you what these look like. So you'll find with our readiness exams, you can get to them over on the left-hand side here, right here under standalone questions, you'll see the readiness exams. And then usually we'll have you in the study schedule, you'll start off by taking a readiness exam, you'll take exams 2 or 3 sometime in the middle, and then exam 4 kind of right before you go to take your NCLEX. So let's see what these look like. So each readiness exam has 4 case studies, and then the rest are standalone questions. And so it's going to look the same as the standalone questions we looked like in our QBank, but the one difference is that when we start clicking on answers and hitting next, we're not going to get that rationale pop up. So we're just going to go through and we're going to click on our answers, and because I don't think you want to watch me click through 100 questions, I'm just going to click on a couple and then we'll submit it, and you can see what this looks like on the other end. So we'll see how good I am with my guessing. Okay. So from there, we're going to hit end, and this is just going to pop up saying I have some unanswered questions, and I know that. So I'm going to hit submit exam. And then we're going to get a really nice dashboard that's going to tell us some really cool things. So it's going to tell us our chance of passing the NCLEX. And so unfortunately, with chance of passing is low, but hopefully yours is showing up a little bit better than that. And then we're going to get some really nice information on how we did. So we're going to get our chances of passing. So we're going to get a low, borderline, high, or very high. And then we're going to get our score. And we're also going to get how we compared to other users in the bank. So you can see where you're at kind of in the pack of things. All right, so those are our readiness exams. And there's one more really cool thing I want to show you. And those are our cheat sheets. And so our cheat sheets is a new feature that we are offering. New cheat sheets are coming out every day, and these are fantastic study guides that you can use as you're studying for the NCLEX. So if we click on one of these, we can see what they look like. All right, so we're working on, we were looking at our cheat sheets, and so these have, like I was saying, just the information you need to know for the NCLEX without getting overwhelmed with all of the detail that you sometimes find in the textbooks. So these are a really great resource that you can use as you're studying. And like I said, new cheat sheets are coming out every day, so you can take a look at all the ones that we have to offer. And Emily, even if you're not a member of NCLEX Bootcamp, if you don't have an active subscription, you can still access these for free. Here we are at our performance page. And so this is a really, really helpful page for you to take a look at because This is going to show you how ready you are to take the NCLEX. So you can see up here, you'll see that